So when you get the aspirate from the person collecting it, you're going to want to put some, I don't have any like that, we're not bedside, so we're going to want to put some directly on the slant smear and let it run down and see if there are any spicules, which they're clinging to the plastic because, you know, and you're going to want to make a push smear. So there are, I don't know if you can see, there are these little flecks, some little white flecks in there, and those are the spicules. There aren't a lot here. This bone marrow's been refrigerated, so it's not the best. But okay, so we're gonna make a push smear, which would be just like you make a peripheral push smear. So you make 2 of those, and then we're gonna wanna pick up some of these spicules with a cover slip. Not. Let's see if I can get my So when you pick up the specimen, there aren't a lot of spicules here, I'm not gonna lie. So let me try to pick up a little here. You want to get just the edge covered like this. Just kind of your edge. I'm going to set it down on the slide, push it towards that, and glide it across. And you should have little clearings in there if there are spicules, but you don't want it any thicker than that. Let's see if we can get. So when you have spicules that you can pick up, it'll make that nice clearing in the middle. I don't know if you can see, but you want a single layer of cells, so they need to be fairly thin. You don't want to push down on it. You just want to let it glide across the slide. So the amount of specimen is important. Letting it spread under the cover slip and letting it glide across. So you have these pushes. You want to make 8 to 10 of these. They're called crush preps. That's kind of a misnomer. We don't want you to push down and crush anything. We just want it to glide. So we're going to make a few of these. And then you will get a bone marrow core. And it will likely come to you on a piece of gauze. So let's see if we can get one for you. Get a piece of core on your gauze. You can do one of 2 things. You can put it onto another slide. I like this better. You can put it onto a slide, and then you want to pick up another slide and you're going to do touch preps. So you want to just set it down and give it a tiny roll. And tiny roll, and it'll give you a pretty thin smear. Not sure if you can see. But again, you want a single layer of cells. Since this isn't actually bone, it's kind of hard to recreate it. It's a wooden stick. So let's see if we can get so that you can see. So you want to just touch it. You don't want to push down on it. You just want to let it roll ever so slightly. And if it sticks on there like that, that's just the right consistency. So that's about perfect when it'll stick on there, that one in the middle. So you want to make 4 of them. You want to touch it probably 2 or 3 times. You don't need to touch it the whole way up the slide or anything. So that would be sufficient for a touch prep. Okay, then your core, I'm not going to open this, but you would put your core in B+ when you were done making your touch preps. So you put it in there and close the lid. Alright. When you're done making your smears and you're back in the lab, you've labeled all of your things. You're going to want to filter your aspirate. So there are many ways you can do this. This is how we do it. You need histo wrap, which are these small circles of filter paper. I'm going to get one, fold it in force. Put it in your funnel. Wet it slightly with saline. Okay, and then you want to take some aspirate that you've collected in EDTA. That's what you want to send for the histology. And you're going to filter it. I'm going to rinse that down in the paper. So in the paper here, you can see at the bottom, we have a few spicules, maybe a small clot. That's what you want to send to us in the B+. So the easiest way to do that is to take your filter paper out. You don't want to touch where any of the spicules are down here. You don't want to smash them. Fold this over and make it look like almost like a tiny baby diaper. Okay? And then this you'll put in the B+. When you put it in the B+, it's going to get wet. It'll open up a little bit. So the baby diaper will open up.
So spicules in one B+, core in another.
So it'll open up like this. And these will kind of cling to the sleds and it'll keep your specimen at the bottom. So it's always in the fixative. But that's how you would send us spicules. You would send us a core in B+, and you would send us spicules in B+. And then if you have flow or genetics testing, that can be done with heparin, and molecular testing would be done with EDTA. Flow is a little unique. It can do EDTA or heparin, but it's easiest probably to collect in the heparin because you can have it have the anticoagulant already in the syringe and collect it that way. Then you don't have to worry about it clotting. So if you have many tests ordered, you have the genetics, the flow, and the molecular, you want to send a specimen for each one. So you can send a heparinized for your genetics, you can send heparinized or EDTA for your flow, and you have to send EDTA for your molecular testing. And then you'll need the 2 containers, your aspirate and your biopsy of B+. And then 2 push smears, 8 to 10 crush smears, and you want 4 touch preps. So those are the different kinds of slides that you have.
What common mistakes do you see?
Many.
Or just ways to do it better?
The technique is very difficult. Maybe take some time to practice. I know you don't always have bone marrow or spicules. You can sort of do it with blood if you pick your specimen up with a cover slip and practice that motion and pull it across. You may not have the spicule look, but you can get the right consistency. So you still want to be able to see through it. If it's thicker than that, then there's so many cells we can't do the dip. So I would say biggest mistakes are maybe the way these are filtered. Sometimes we just get a ginormous clot just thrown in the B+. And then the actual making of the smears, which takes some practice. I know there are other ways to make smears. You can use 2 slides, and I can show you that. The caveat is that you can't push down because it breaks the cells. So when you have 2 slides, if you have a drop of bone marrow on here and you place another slide on top, you want to let it spread out and then pull. You don't want to push down. It's that gliding motion again. So you can still see through it. It's still the right consistency. There are some clearings you can kind of see. So that would be where we would need to do our dip and where the pathologist will look at the morphology. The trick is to not push down because the 2 slides are pretty heavy for the cells and it'll break them. But you can make slides like this. The important part is to try to find some of those clearing areas. Sometimes it's fat, sometimes it's spicules. Really difficult to tell the difference, but if you have some of those clearings, there's a chance we'll be able to at least do a differential and look at the cells. That's about, you can make your push smears as you would a peripheral smear. If you don't have a cover slip, you can just use another slide and make it just like you would your bone marrow push smear. You can make it just like a peripheral push smear. That should be a good start.
Thank you.
Mm-hmm.